Hey guys, it's Jay and welcome back to my channel. I'd like to welcome you back to Respiratory Therapy Essentials for the TMC exam. If you are a respiratory therapy student or someone who are trying to pass the TMC exam, you're in the right place. If you want to learn more about respiratory therapy, you're still in the right place. All of our content, however, deal with information to help you pass the TMC exam on your very first attempt or your very next attempt. Now, tonight we're talking about the initiation of mechanical ventilation, one of the bread and butter for a respiratory therapist. I don't have a whole lot of time. Hit that like button if you like this video. Let's go. Hey guys, as far as I am concerned, initiation of mechanical ventilation is one of the bread and butter for any respiratory therapist. You have to know this information and you have to know it when you go to sit for the exam. Let's do this. Now, we're talking about the initiation of volume ventilation. We'll talk about pressure ventilation later because that's a whole different set of circumstances. So in volume, to set up the ventilator for volume ventilation, you want to use a rate of 10 to 20 breaths per minute. The FiO2, you see how I got this? Some books say 30% to 60%, some say 40 to 6%, but it's okay. Whichever you use, you know, oxygen is a drug and we want to use the least amount as we possibly can, but we want to give the patient what they need. So for your FiO2, set it at 30 to 60% or 40 to 60% to start out with, okay? If the patient was already on an oxygen level, then just leave it the same. If they was already on 35%, just leave it at 35%. If they was on 30%, leave it at 30%. That would be just fine. In emergent situation, we always give 100% oxygen. In emergent situation, we give 100% oxygen. Start your PEEP. So you start your PEEP around 4 to 6 centimeters of water pressure, okay? You won't go wrong with using those values, anywhere between 4 and 6 initially. Therapeutic PEEP that you should always remember. And when we say therapeutic, we mean that a real medical problem is going on. And we use a PEEP of 10 centimeters of water or more, okay? And on this exam, you will go. They will take you higher than 10 centimeters of PEEP, all right? I personally seen them go all the way up to 18. Some people say they can go up to 20 or 25. Just whatever the situation is on the test, don't shy away from it. If they need the PEEP, give it to them, all right? If a patient is on a CPAP of 5, put them on a PEEP of 5, very simply, right? Just to keep, have some kind of rules and guidelines. If they're on BiPAP, if they were on a BiPAP, then we would use the EPAP side of BiPAP to put them on PEEP. For an example, if they're on a BiPAP of 15/5, well, 5 would be the EPAP side, right? Then we would use 5 if we put them on the ventilator and put them on PEEP. We'll use a 5 because they was already on 5, all right? They was on an IPAP of 15 and they were on EPAP of 5, all right? So we'll put them on 5. Problem number 2, if the patient have R's, we treat them with 10 centimeters of water pressure of PEEP to start, or we add PEEP up until 10 and we go higher and higher, okay? Because we already know that this patient has a bad lung compliance. So for R's patient, don't be surprised to see 10 centimeters of water pressure for the PEEP, all right? Don't shy away from it because they need it. Mode of ventilation. Now, as everyone say, mode don't matter to initiate mechanical ventilation. I agree. However, let's talk about good mode that you must know, all right? SIMV is the most comfortable and the best mode, SIMV. And you can use SIMV for volume control or pressure control. And when we talk about pressure control, we'll talk about that. Assist control is the second best mode, all right? You go from SIMV, and if you need to, you can go to assist control. Pressure support ventilation is used when the PCO2 is elevated, but the pH is in 7.28 to 7.35 range. All right. We use pressure support when the patient is intubated and need a little help to increase the tidal volume. Basically what it's for, because it helps overcome the resistance of the endotracheal tube. Roman number 3, we're talking about the tidal volume now. You can use 6 to 10 milliliters a kilogram per predicted body weight. Don't get in trouble on this exam using ideal body weight. And I'll show you at the bottom what I'm talking about. If the patient has reduced lung compliance, then when we talk about the tidal volume, then we have to go to the RNet protocol, even for the initiation of mechanical ventilation, okay? If they have reduced lung compliance, go to the RNet protocol. Otherwise, use 6 to 10 milliliters a kilogram, okay? The tidal volume is based on predicted body weight, not ideal body weight anymore. Now, you may get by with this on the exam, so be it. But nevertheless, I want you to know what you're going to see in the future, and more so right now. So the calculation is at the bottom of this board. For males, you use 50 kilograms plus 2 times 3 times height in inches minus 60. Female, 45.5 kilograms plus 2 times 3 times height in inches minus 60. Now, if they get you off your game when you sit for the exam, it will be on tidal volume and oxygenation. You know why? Because these are 2 life functions. These are your 2 life functions: ventilation and oxygenation. When you're setting up the patient on the ventilator, always know that you have ventilation and oxygenation intact. And there you have it. Hey guys, that one was fun. Listen, you have to know the initial setting of the ventilator on this exam. Don't let them get you on the tidal volume and the FiO2. That's where they try to get you at, okay? Hey guys, I need your help. If you like this video, hit that like button, subscribe to my channel, turn on post notification bell, because I'm giving video every single week. This is my 28th video, 27th video, but I'm on my way to 140 videos on nothing but content for the TMC exam. And until next time, we out.